a short and simplified video on the classification of dentin, a must-known topic for every dental student. In this video, we will explore all the major types of dentin. Each type is presented in an easy-to-understand table format, so you can quickly memorize the key characteristics, perfect for your MCQs, theory exams or viva preparation. So let's get started with the first category, that is the dentin classification based on time of formation. It is of two types, primary dentin and secondary dentin. Primary dentin consists of circumpulpal dentin and mantle dentin. Circumpulpal dentin is the primary type of dentin that forms the bulk of the tooth located beneath the mantle dentin and surrounding the pulp chamber. Over here, this main bulk of the primary dentin is your circumpulpal dentin. Next is your mantle dentin. Mantle dentin is the first layer of dentin formed in the tooth crown, positioned just beneath the enamel. It's a relatively thin layer and is characterized by its lower mineral density compared to the rest of the dentin. So over here in this diagram, we can see this is your mantle dentin. Next is your secondary dentin. Secondary dentin is a type of dentin, the hard tissue that makes up the bulk of the tooth that is formed after the tooth has erupted and is functional. It is produced throughout life, although at a slower rate than primary dentin, and it helps to reduce the size of the pulp chamber. It contains fewer tubules as compared to primary dentin. So over here, this is your secondary dentin that is formed after the root formation is completed. Next is the classification of dentin based on structure. It is of three types, peritubular dentin, intertubular dentin and your predentin. So, peritubular dentin is a highly mineralized dense layer of dentin that surrounds the dentinal tubules within a tooth. So, in this diagram, we can see these are your dentinal tubules. They are surrounded by your peritubular dentin. Next, we move on to intertubular dentin. As the name suggests, intertubular, it is found in between your peritubular dentin. It is a primary structural component of dentin that is found between your dentinal tubules. It is a less mineralized matrix compared to peritubular dentin, primarily composed of a collagen fiber and hydroxyapatite crystal network. Next, we move on to predentin. Predentin is the newly formed unmineralized layer of dentin that is located adjacent to the pulp tissue in a tooth. Over here in this image, we can see this thin layer is of predentin. Now we move on to the dentin classification, which is based on age changes. It is of three types, dead tracts, sclerotic dentin and your reparative dentin. So first we'll start with dead tracts. These are the areas in dentin where dentinal tubules which normally contain odontoblastic processes are empty due to the degeneration or death of those processes. These areas are often found beneath carious lesions or other injuries to the tooth where the pulp has responded by forming a barrier to protect itself. A key characteristic of dead tracts is they appear black in transmitted light and white in the reflected light. Over here, these are your dead tracts. Next is your sclerotic dentin. It is also known as transparent or translucent dentin. It is a type of dentin which is characterized by the deposition of mineral salts within the dentinal tubules, leading to their obliteration. It appears transparent under transmitted light. It is of two types, physiological sclerotic dentin and pathological sclerotic dentin. Physiological dentin, it gradually develops with age, starting in the root and progressing towards the crown. It is a response to the natural wear and tear on teeth over time. Pathological dentin is a protective response to stimuli like caries, erosion or mechanical damage. When dentin is damaged by odontoblast, it may deposit peritubular dentin to seal off the tubules. So over here, this is your sclerotic dentin. Next is reparative dentin. It is also known as tertiary dentin. It is a type of dentin that forms in response to any injury or irritation of the tooth, such as from decay, wear or restorative procedure. It is a protective mechanism that helps shield the pulp from any further damage. It is characterized by having fewer and more twisted dentinal tubules than your normal dentin. In this image, we can see the whole process of your reactionary dentinogenesis and your reparative dentinogenesis. Next is your interglobular dentin. In your exams, they keep a slide of your interglobular dentin. So, kindly learn this properly. Interglobular dentin is a region of poorly mineralized dentin that appears as darker, arc-shaped areas in histological sections of the teeth. They are characterized by incompletely fused calcosporites, globular mass of mineralizing dentin resulting in a hypomineralized matrix. With this, we complete all the different classifications of dentin. Kindly go through all the tables that have been mentioned in the slides, as it may help you to memorize the characteristics of dentin. Thank you. Kindly share and subscribe with your friends for daily dose of dental MCQs and more such short videos.